Patient safety is obviously a really important part of what we do in our clinical practice, and one of the issues that we have more and more now is that a lot of therapies are becoming oral therapies, and if a patient's in hospital and you give an infusion, you have control over how much of their medication they get, and when it goes in as a bolus intravenously, you know that they've had the full dose. One of my concerns is around safety of patients taking their own medication. I believe very firmly that patients should be partners in their care and that they should be able to self-administer their drugs, provided they understand the risks and benefits associated with that. One of the issues that I find is a recurring theme is that many patients don't take their medication as it has been prescribed, either through lack of information and education on our part, or maybe because at the time when they were given the medication, they were overwhelmed with lots of other factors. So for me, safety around medicine taking covers many different facets of the care pathway for the patient. So one is actually taking the right medicine at the right time. The other is about reporting symptoms and side effects from the treatment early so that the medication doesn't cause the patient to become unwell or harmed in any way due to over-compliance, i.e. taking it when they're no longer getting the ideal benefits and it's actually becoming toxic and poisoning the patient through overdose or overuse. And the other thing is around giving patients ongoing support at regular touch points through their care pathway, where you can help them with issues that may flag up that may not have been initially obvious when the patient first started their medication, but that may become a problem over time, maybe weeks or months into their therapy. So part of what we do is actually provide support to patients at regular intervals to keep them on track with their medication, to encourage them to report any side effects or symptoms very early so that management can be optimised, and to keep the patients on their therapy for as long as we can, to keep them as well as we can. Healthcare for patients taking their medication is really important, and all the healthcare professionals have a role to play in it. The resources within hospitals and primary care are becoming more and more stretched, and therefore we all have a role to play in this. One of the things that I find is a challenge is actually trying to give the patients enough information and advice during a very short clinic appointment or an outpatient visit, and therefore the patients quite often don't get all the information they need, or maybe are bombarded with information and get too much and then don't know how to filter that information in a useful way for them. So the healthcare professionals, nurses, doctors, pharmacists all have a role to play in ensuring patients get the right medication and on time. However, the time restraints within a clinic environment make it very difficult to ensure that the patient's getting all the information they need.